everybody. This your girl, Nikki Nicole of Divas of the Roundtable Podcast. I'm joined here with my girl, Spicy Red. And today's show and for the next show, we will be missing our girl, Ladybug. Ladybug had a family situation that she had to deal with, so she would not be in attendance. But she is ever so much a diva of the Roundtable. She would just be missing for the next couple episodes. On today's episode, as you can see, me and Spicy are wearing pink. And we are wearing pink because October is Breast Cancer Awareness Month. I myself lost my grandmother in 1970 to breast cancer. And Spicy?
I lost my grandmother September of 2019.
Okay, so 2019 for Spicy, 1970 for me. I can say I personally have had a breast cancer scare recently. As you all may know, I went on Facebook and said that I had a mammogram done and they found a lump in my left breast. I had to go back for a second mammogram. It was still something there. I had to have an ultrasound. It was still something there. So eventually I had a biopsy done. And good news is the biopsy came back that everything was normal. It was just scar tissue from a previous breast surgery that I had in 2003. So last year and this year was my first time having a mammogram. And unfortunately, last year the scar tissue went undetected. So it was a little scary, and it was a scary time for me. So with that being said, I just kind of dove into the breast cancer thing. We've had a couple classmates and friends and family that have had to endure those scares, and some of them who had to endure cancer itself and go through treatment. I personally knew of a lady several years ago. She actually helped my sister with the flowers and stuff for her wedding when she was getting married. And Miss May, beautiful lady, lived over there in a nice house over there for Dunn Avenue. And next thing I know, she was dead. She had breast cancer, and it had came back. And so she ended up dying. So with this show here, we just wanted to take time out to propose some questions and give those answers for those of you who may be curious about breast cancer, those of you who may not be aware of the signs and symptoms surrounding breast cancer, and those of you who have family members and or friends who have gone through treatment, on the other side of surviving breast cancer. So we just wanted to talk about that a little bit today and just, bring awareness to the fact that October is Breast Cancer Awareness Month. So rock your pink, you guys, ladies and gentlemen. So I'm going to start off with the first question and answer about what are the early signs and symptoms of breast cancer. So the early signs and symptoms of breast cancer can include a lump in your breast and underarm, swelling and changes in the breast, in the shape and size of the breast. Also, you can have nipple discharge, skin irritation, or pain. However, it needs to be noted that some women don't have any symptoms at all. So that's kind of scary that your body could be doing something crazy.
It is.
And you have no symptoms of nothing that's going on, So Spicy, if I remember correctly, you had a situation a few years back to where you had a scare as well.
Yes, I did. I was getting ready for work, just getting ready to get in the shower, get ready for work. I work night shift. And so I'm just say do a self-exam. Mm-hmm. And so I did. I found a lump on my right side. And then I was like, we'll get in the shower. So when I got to work, I also had my coworker to do one on me because I worked in the hospital, So she felt it also. Mm-hmm. So when I went to my appointment, they not only found one on this side, they found one on the other side, which I couldn't feel that one because it was actually a bubble behind the breast tissue. I have a tattoo on my back. Mm-hmm. And so the ink absorbed through the back part of the tissue behind my breast. And it was a pocket just of ink was just sitting there. So when I had the surgery done, they both had to be removed. Mm-hmm. But it was a scary situation. Everything turned out to be pretty good, but I have to have a mammogram yearly.
Yeah.
That's a must.
Yeah. Yeah. So for me, having that initial mammogram. And I was so used to the mammograms being normal. Well, like I said, I had only had 2. So I had the previous year was normal. Mm-hmm. So automatically when I log in to my chart online, I'm assuming it's going to be normal. And then you get the normal, abnormal, we found something. So I actually, when I got the results, I had to crew up the next day. So I literally had to put that in the back of my mind and focus on what I had to do, because I had already exchanged some time with a guy because we was getting ready for the Apollo and Athena show. So I had to go to work a little bit early, and the arrangement had already been made. The agreement had been made. So my husband was like, what are you going to do? I'm like, I'm going to work. But the whole 2 weeks on the job, you kind of wonder, is something going on? Is this serious? And then your mind kind of playing tricks on you, you trying to rationalize the results. You kind of saying, well, it could be this, it could be that, it probably ain't nothing, it's this, it's that. And so those 2 weeks to get back just to have the second mammogram done, that's a scary time. And then you're playing that waiting game from the results from that second one. You know what I'm saying? So yeah, I understand the anxiety that a lot of women probably carry dealing with a diagnosis of we found something. Well, not a diagnosis, but just observation that they found something.
I had that same thing happen probably about 2 years ago. I had one that pop up abnormal, and then I had to go over there on 8th Street because I usually, at that time, I think I was just doing Baptist. So they sent me over to UF on 8th Street. And I had to get I've never had this done before. It was like a weird type of sonogram, but I actually was standing up like it was a mammogram. And it came out scar tissue also from the breast surgery.
From the breast surgery.
It built up over the years. And they finally started seeing it. So it's like now, I just had a mammogram done. We both had a mammogram done like a week apart from each other. I just had one done like 2-3 weeks ago. Okay. And so now it's like, now that they know the scar tissue there, they kind of overlook that and just look for other things. Because I asked her about, was it going to pop up again? You know, because I don't need to be scared again for a second time.
And that's the thing, like with me, with having the biopsy done, it's a little metal probe that they put into that area to let them know that this is an area that they've already acknowledged, they've already took something from, and it's nothing to be concerned about. And it was kind of cool because they had a little glass encasement showing the different shapes. One was shaped like a heart, one was shaped like the breast cancer ribbon. One, I'm still, I don't know, part of me said it looked like a dragonfly, but then when I turned, it kind of looked like a AK-47. I don't know what it was, but it was just really, they was really, really small, little metal things that they can insert in you, markers to let them know that they've already checked that out and that it's okay. So what you got for your question and answers?
How often should women perform self-examination for breast cancer? Women are encouraged to perform breast self-exams once a month, ideally, a few days after their period ends, when the breasts are least likely to be swollen or tender. Self-exams are not a substitute for mammograms. They help women become familiar with how their breast normally feels, making it easier to detect changes.
Yes. And that's something I was guilty of. I remember she's Donna Deegan now, but she was Donna Higgin back in the day when she had her breast cancer situation. And she was the one who kind of like popularized the buddy check, buddy check 12. That was her thing, and that she pushed in the community. And I remember my mom having a little thing hanging up in the shower, showing you how you do it when I was young, because it was a long time ago Donna was diagnosed. And I had never did one. And still to this day, even sitting there in the breast cancer facility, and they asked me, and I was like, no, I still haven't done one, and I'm just like, what the hell are you doing, Nicole? You know what I mean? Seriously, because it's so easy to do. You're already in the shower. You're already lathering up, washing your body down. Go ahead and check them out. And just, like you said, get familiar with how they're supposed to feel and notice any changes that happens with your breast, because it is a serious thing and it's a big battle for most women.
And also, instead of you doing an examination on your breast, also go underneath your arms, like Nicole mentioned earlier. Always check underneath your arms. I know a lot of us carry lymph nodes.
Yeah.
So you kind of have to be familiar if that's what you're feeling.
Yes, so for sure.
That's another thing.
Okay, so here we go. What is the recommended screening guidelines for mammograms, and at what age should women start getting them? So the American Cancer Society recommends women with an average risk start having mammograms at age 45. So I was 48. I was late getting mine. So it says that they should start having them at age 45. Women 55 and older may switch to having a mammogram every 2 years. So I guess once you make it to 55 and older, you could kind of back down a little bit, but every year for sure, if you're at age 45. Some doctors and places recommend earlier. It's nothing wrong with having a mammogram earlier, especially if you have a family history surrounding breast cancer. You can also, just start early. I say maybe 35 it'd be a good age, because I have, since my scare, I have been talking to people, and I've talked to 2 ladies who said they had a scare in their 30s.
I can believe that.
So I'm like, I could see definitely having it earlier, having it done earlier. What you got, Ms. Spicy?
Can men also get breast cancer? If so, how common is it? Yes, men can get breast cancer, though it is rare. Less than 1% breast cancer occurs in men, but all men should still be aware of the risk and the symptoms, especially if they have family history.
Yes. Yeah, because so that's another thing. I was just telling a friend of mine the other day about gynecomastia, how men can develop breast tissue. And, I say, have you ever seen like a slim dude that works out? He's in shape, but he just has some fatty tissue around his breast. That's gynecomastia. And so a lot of men are embarrassed about that, just dealing with breasts, period, saying that word. But the fact of the matter remains, they can develop breast tissue. They can have breast cancer, they can have excessive breast tissue like a woman, gynecomastia. You can have, like we said, breast cancer. What you said, less than 1%? Less than 1%, but you don't want to be in that number. And if you are in that number, you want to make sure you're up on your health and give yourself a fighting chance to battle breast cancer if that's your diagnosis. So let's see. What are the specific risk factors that increases a woman's chance of developing breast cancer? Are there? So the answer to that is yes, there are risk factors, and the risk factors include being older than age 50. You can have a family history of breast cancer. That would increase your risk factor. Genetic mutations such as BRCA1 and BRCA2. You could have DITS, breast tissue, exposure to radiation, hormone placement therapy, obesity, and excessive alcohol consumption, which I checked off several of those. So for me, it's like I'm reading these things and I'm like, oh my goodness, which I have officially stopped drinking. So for me, I looked at these things and I know I do have a family history. And I don't know how this got away or off of my chart, but on my chart, it was not even, a notation wasn't even made that my grandmother had died from breast cancer. So while I was there having my mammogram, the lady, she's like updating my chart, and me and her just talking, and she's like, oh my God, that's not on your chart. And she's just typing. And I have an aunt that has battled it twice, a cousin battling breast cancer. So it's important that you update your history, your family history, or you make sure it's a complete family history in your charts, because that would determine how often doctors may need to test you, give you mammograms or have the genetic testing done.
Yep.
Have you heard of like the genetic testing? Is it an expensive process? Do you know?
Not sure on that, but I know I have my grandmother on mine and my grandfather.
Okay.
Yeah, so I that's on my family history.
Okay.
I've been did that, but yeah, they ask the questions.
Yeah.
And you want to know, even if you have to, like you picked up the phone and called your aunt today and asked some questions about your grandmother. So yeah, it's good for you to know your family history, especially with us being in the Black community.
Yes.
And like we talked about before, a lot of family members, parents, they hide
stuff,
secrets.
yeah.
They hide secrets. So you may have to have that sit down with one of your family members that's still living and ask questions.
Yeah.
You never know until you ask the question.
Yeah, that's true.
Okay, what lifestyle changes can help reduce the risk of developing breast cancer? Maintaining a healthy weight, exercising regularly, limiting alcohol intake, eating a balanced diet, avoid smoking, and breastfeeding if possible.
Yeah, they want you to, breastfeeding is good. It's good for it, yeah.
Okay.
So they recommend breastfeeding of course they will. That's
to reduce.
To reduce the risk of breast cancer, but for sure, if you can, breastfeeding is the way to go anyway.
I breastfed one of my babies. The other one wouldn't latch.
Yeah, they weren't going for it. They weren't going for it. I think Jermaine latched on that first night in the hospital, and you know how you have to change him over. He was like, "Nah, I'm good." He didn't want no more. He didn't want nothing else to do with that. Okay. Okay, so here we go. Let's see. How can genetic factors like BRCA1 and BRCA2 mutations influence breast cancer risk? Let's see. Women who inherit mutations in the BRCA1 and BRCA2 genes have a significantly higher risk of developing breast cancer and ovarian cancer. Genetic testing can help identify individuals at a higher risk, allowing those monitoring and preventative options such as risk-reducing surgeries. So if you have these inherited mutations, they really, really recommend that you stay up on it, keep getting tested, getting your genetic testing done, and hopefully it can get you into treatment earlier if you do develop breast cancer. And that is important. Like we said, knowing the family history. And people have to understand, especially in the Black community, we don't want to talk about the inevitable. We don't want to talk about death and all that stuff. So we need to ask these questions and find out, okay, grandma had it. Mama may not have it, but do I need to get tested for it? Do I need to get these, genetic testing done? And also, your brothers, do they need to get it done? Because they may go on to have children. And it's a genetic mutation. Yeah. Genetic mutation can go through any person in the family. You know what I'm saying? And it could be passed down to any generation. So it's very important for us to be up on top of that and make sure we get ourselves tested and checked out.
Okay, what are the different stages of breast cancer and how do they impact treatment options? Breast cancer is classified into stages 0 to 4 based on tumor size, the lymph node involvement, and whether the cancer has spread it to other parts of the body. Mm-hmm. Stage 0 is non-invasive, while stage 4 indicates metastatic cancer.
Yeah, stage 4. The dreaded stage 4. So yeah, with the 0, you kind of know it's non-invasive. You caught things right at the beginning of it, and it's hope through all of it, but it's not it's kind of like the starting of the war. You know what I mean? Stage 4, now you deep in the battle. You in the trenches at that point. So, but all of it, like we say, hope, it's hope, and you have prayer, and you still have to be vigilant, and you still have to stay up on the recommendations of your physician, and just fight that thing head on if that is your diagnosis, you know.
Because I know with my grandmother, we never really went through the stages with her. She must have had it, but no symptoms. So when we found her in the house unresponsive one morning, we had to break into the house because my grandmother's house had burglar bars all the way around the house, even the doors. So they had to find a way to break into the house and found her. And so I think at that time she just had a fall. And so when she had went into the hospital and they ran tests, that's when it came back. And I think at that point, she probably was like a 3 or 4 already.
Okay.
So she was not having no pain that we knew of. She didn't start having the pain probably right before her last week, her last couple of weeks before she passed on. But yeah, it was weird, basically, because I knew that when they said they wanted to go in her side, and I know once you open the body, the cancer patient, it spreads once the body is open. So I already knew, you know, y'all wanted to go in. I knew it was gonna be not good at the end, but yeah, that was a scary feeling for my family, but we lived through it. I felt like, you know, she's going on the better place or whatever now. But yeah, that was hard.
And you know what? Like you said with your grandmother, she didn't know, you know, and no pain. It's funny though, because like we had experienced the same thing with our dad, you know, and he had the pancreatic cancer, and he actually died not knowing where he was dying from. We found out on the death certificate, and it's like that older generation, man, they some kind of tough, man. They're a whole different type of tough. You know what I'm saying? And it's like sometimes it made me think about my dad. Like, was he experiencing pain? But just kind of like, you know, brushing it off because they were raised that way. You know what I'm saying? To kind of like just suck it up and deal with it and pull themselves up by their bootstraps and just keep moving. Yeah. But I say, if you have, you got a hangnail, go to the doctor to find out what's going on.
I later on, I think around the time my grandmother was sick, I was still working at UF, and I later found out that the neighborhood that my grandmother was raised in, the soil caused the cancer. I think that was like Lackawanna mixing area. Yeah. And that's where she was born. Every last one of my grandmother's siblings had cancer. Oh, wow. One of my co-workers told me her mom, her family grew up over there too. Her mom was 35. Between 35 and 38, her mother had also passed away from cancer. Wow. And that's when I found out that it was the area that they lived in. Yeah, because there was some kind of lawsuit where where they was able to file and get money. I remember that because Mr. Clark had got some money from that. I don't think my mom did it from there. She wasn't over in Mixertown area, but over in the bottom, it was something like in that area too, like that they had a dump. It was a dump or something like that. Yeah. Houses were built on. Okay, so let's see. I think it's my time. Let me see. Yeah. What treatment options are available for those diagnosed with breast cancer? So treatment can include surgery, a lumpectomy, or mastectomy. You can have radiation therapy, chemotherapy, hormone therapy, targeted therapy, or any combination of these. So those are some of the available options for people diagnosed with breast cancer. And I just look back to the fact that, like I said, my grandmother died in 1970, and so much has happened since she passed away. Because I think it was like a whole decade or so before Susan Kohler, I think that's how you pronounce her name, the lady who the famous breast cancer ribbon is named after. Her Coleman, Susan Coleman, I'm sorry. Her sister dedicated her life to
bringing awareness to breast cancer and breast cancer research. They was also credited with having the first grant that was given for breast cancer research. They are accredited, that foundation is accredited for the breast cancer ribbon that we know of today, the pink ribbon. So, but her sister died, I believe it was 1982 or 83, which was like a decade after my grandmother actually passed away, because so we're going to say maybe she probably was diagnosed or something in the late 60s and she died in 1970. It was treatment, let alone having a cure, especially for Black folk at that time, was practically non-existent. That was basically like almost like a death sentence, or it was a death sentence for people, especially people of color back in that time. So I just, I don't wish that she never had it at all, but if it would have been a different time, it may have been a different outcome. Yeah. So what you got?
What can survivors experience during and after treatment? Survivors can experience fatigue, lymphedema, body image changes, and emotional challenges such as anxiety and depression.
Yes.
Women should look for support groups in their area if diagnosed with breast cancer. Yes,
that's true. So, yeah, I mean, because you can imagine a woman, especially with it being metastatic breast cancer, or, they're trying to have a lumpectomy and done, and you will get the breast removed. So now you're a woman who goes from being a young girl with no breasts, developing breasts, being a woman with probably voluptuous breasts and maybe loving your body, your image. And then in order to save your life, you have to lose this thing that made you feel so much like a woman. Because, like being a young girl, you're trying to stuff your bra because that's made you feel grown and like a woman. And now, and it could have been like, even if you had children and you nursed your babies on your breast.
Looking in that mirror at that scar.
And now you have to look at that scar. So I can imagine the body image changes and how that can lead to depression for some women dealing with breast cancer. So I just want to throw a couple numbers out here, you guys, before we get up out of here. In 2024, 310,720 women will be diagnosed with invasive breast cancer in the United States in 2024. 42,250 women will die in 2024 in the United States from breast cancer. Those are staggering numbers. Yeah. That's a lot of women. And that was one of the things that I said when I was sitting in the waiting area, waiting to go back and have the biopsy done. And I'm seeing so many women come in, and all of them had the little gowns draped around them like me. And we're all just sitting there, and they're on their phones and, puzzle books, just waiting in the waiting area. And I'm looking and I'm saying to myself, somebody in this room is not going to get a good result. Yeah. Somebody in this room may end up having to fight for their life. Somebody in this room may lose that fight for their life. I thank God I was on the other side of that, and mine was just a scar tissue scare. For all the women out there who are dealing with breast cancer, have dealt with breast cancer, or just for children, men, friends, family, women, anybody who's supporting women dealing with breast cancer, our thoughts and prayers are with you all, because that's something that Spicy had to personally endure with her beloved grandmother. I saw the Facebook post, what would have been her, 80th birthday?
81, I believe. She died before, I think 82, 83, because she died before she turned 80.
Okay. Yeah. So, and y'all just, everybody, I saw the post your daughters made and you made. So, even when women go through breast cancer and those that don't survive, they leave a legacy behind of, women who you may think that it could possibly be me. I just recommend to everybody to go get tested if you have a family member, especially a close family member, mother, grandmother, aunt, that was diagnosed or fought breast cancer. If they won the battle or if they lost it, you do your due diligence and get yourself checked out. Make sure you get tested. Make sure you let your doctors know. Like I said, it wasn't even in my chart. So I had to update my chart as to what my family history was. Know your family history, know your health, know your breasts, get those exams, do those exams. Do those self exams. Like Spicy said, that's a way to where you get to know your breasts, how they're supposed to feel. Anything strange that comes up, you will know it. So you guys take care of yourself. This is Nikki Nicole and Spicy Red. We sounding off for Breast Cancer Awareness Month, Divas of the Round Table. Thank you guys for tuning in. Y'all be blessed.